Johnson & Johnson's chief scientist said yesterday they started the work on a vaccine 2 weeks ago. So when should we expect it to be ready?
So the problem with vaccines is sometimes it can take weeks to months, even until they're ready, because even with rapid production, it has to be tested for safety, for efficacy. Even with the H1N1 pandemic in 2010, we had the vaccine, but we didn't know until weeks or months later if it was effective.
Are you of the same view as Dr. Scott Gottlieb that the diagnostic issue is a point of friction in this process that needs to be solved and can be solved in short order?
Right. So currently for diagnosis, samples, blood samples, as well as respiratory samples have to be sent to the CDC. So it's not a quick diagnostic turnaround. If we could have a rapid test similar to what we have for the flu and other viruses, it would help immensely.
It sounds great in theory, but how feasible actually is that?
Right. So since it is a novel virus, we have to develop a way to test that quickly and with the accuracy and efficacy to get the accurate result.
Do surgical masks protect you?
Not exactly. You know, the main thing is washing your hands frequently, avoiding contact with areas and sick people where you know they have the virus. The masks can help, but they're not, foolproof measure by any means.
The White House stopped short of declaring a public health emergency this morning. Was that the right call?
Yes, I don't believe it's time to panic, at least here in the U.S. We have 5 cases, but they're all isolated. And at least on U.S. soil, there hasn't been any human-to-human spread.
You know, obviously the loss of lives is terrible and getting that under control, but I worry about the domino effect that this could have in China. And as we think about manufacturing here in the U.S. and how many companies rely on that level of manufacturing to support the supply chain here, if things are shut down, people aren't working. If people aren't working, the income's not coming in. And more importantly, does the supply chain in the states get broken? So when you look at these big retailers who rely on textiles and fabrics and clothing and other items to come into the U.S.
And going to China to set that up.
That's right. And so when I think about businesses that I have, I send over product development people on a regular basis to work on new ideas and new concepts. If that supply chain is broken for the U.S., you could expect the back half of this year for some retailers to have unexpected margin compression and a supply chain problem.
So let me ask you a question. If a patient came to you and said, I'm scheduled to go to Shanghai next week, what would you tell them?
I would tell them not to go. All non-essential travel should not happen because we're seeing it spread rapidly in Asia. There's over 100 deaths already, 5,000 cases.
Is there a time frame on that caution? In other words, would you, I mean, obviously, we'll have to wait and see what happens.
Right.
But if someone was planning to go in the summer, would you say, well, you can probably keep your plans? Or would you say, I don't know, see if you can get that money back?
Yeah, I would say we need to wait and see. We need more information. It takes up to 2 weeks to even show symptoms.
Do you have a time frame of when you think that things will get back to normal and how businesses can start to redeploy? When you would say it's okay to go?
That could take months because currently it's quite widespread in Asia. Hong Kong just shut its borders down. It could easily take months to develop a vaccine to get the spread
And I would
control.
expect companies here in the States to even be tougher on allowing their employees to go because of the liability they would have in letting somebody go over there.
And there are just so few corollaries that we have with Zika, with Ebola. These were not originating from centers of commerce where companies were having to completely rethink the way that they did business. But I just want to ask you one last travel question, and it's one step removed from Tyler's, which is, would you go to one of the airports, one of the 20 airports where the screening is taking place? Is that, at this point, too big a risk?
I mean, I would avoid it, at least in the upcoming weeks. Flights are being canceled to that region, so it might become less dangerous.
But airports here in the U.S.
Airport, JFK, LAX,
San Francisco.
So those airports I would not avoid because there's no need for mass panic as of yet in the U.S. And flights are being grounded. So wash your hands, take all the precautions you can.
An abundance of caution. We're learning as we go. Dr. Parikh, we appreciate your expertise. Thank you.